That's all. Okay. Hello, everybody. Today's live chat is on endometriosis. So we're going to focus on endometriosis and associated issues with fertility. So if you have any questions, please inbox it to us and I will answer them as soon as I've finished my talk. And right now I will address certain frequently asked questions about endometriosis. So the first question is, what is endometriosis? So the lining within the uterine cavity is called the endometrium. And this endometrium gradually thickens during the course of the cycle and is influenced by the hormone called estrogen. And if a pregnancy does not occur, this endometrium is shed as a period. Now, normally, endometrium should be present only within the uterine cavity. But in about 10 to about 15 in 100 women, the endometrium grows in other places. The commonest places where it grows is on the surface of the ovary, on the surface of the uterus, sometimes over the bladder and the rectum, and very often on the covering or the inner lining of the abdominal cavity, which is called the peritoneum. Now, the important thing to remember is that whenever a period occurs, the endometrium, which is found outside the uterine cavity, which we refer to as ectopic endometrium, also bleeds. And the endometrium or the ectopic endometrium, which bleeds repeatedly and is present on top of the ovaries, over a period of time, forms what is called a chocolate cyst. So this chocolate cyst is nothing but a collection of blood caused by repeated bleeding into the ovarian tissue. These chocolate cysts tend to grow bigger and bigger as time progresses, and they can actually destroy normal ovarian tissue and reduce the number of eggs which are present. In other places, this ectopic endometrium produces inflammation and fibrosis. So in layman's terms, this produces scarring, and the tissues tend to stick to one another, producing tubal blockage, tubal damage, and adhesions, which can reduce your chance of conceiving. So that's about endometriosis. Now the next question is, what causes endometriosis? The thing is, we still don't know what causes endometriosis. Many theories have been proposed, and sometimes endometriosis is called a disease of theories. So one easily understandable theory is that of retrograde menstruation. Every time a woman menstruates, some blood from within the uterus can leak backwards through the tubes and spill into the abdominal cavity or pelvis. This blood can contain tiny fragments of endometrium, and it can implant in the pelvic cavity over the surface of the ovaries and in other areas. This doesn't happen in everyone because 90 out of 100 women do show the presence of retrograde menstruation. But only few of them, 10 out of 100, can develop or do develop endometriosis. So we believe that some women are genetically predisposed to develop endometriosis. And this also explains the fact that endometriosis tends to occur in sisters and occur in first-degree relatives, and therefore tends to run in families. Estrogen, which is a hormone, is very important for endometriosis to proliferate or grow. And most of the treatments we give are directed against estrogen, to reduce the amount of estrogen in the person's system. And once a lady reaches menopause, because estrogen levels are very low, endometriosis usually resolves. Until then, it tends to be a progressive disease. So the next question is, how common is endometriosis? See, as I said earlier, about 10 in 100 women are likely to be affected by endometriosis. But in a fertility clinic, we tend to see endometriosis more commonly because many of them are associated with infertility, or most of the patients present with infertility. So we see it in about 30 to 50 out of 100 patients. The next question is, what are the symptoms of endometriosis? The thing about endometriosis is that the severity of symptoms is not usually proportionate to the extent of disease. That means a woman with mild endometriosis may have severe symptoms, while a patient with extensive disease can have no symptoms and be diagnosed to have endometriosis incidentally on a scan. But for those women who present with symptoms, the common symptoms are, first of all, painful periods. Period pain can be present prior to the period, can extend during the period, and can last longer than a period. And this pain sometimes can be excruciating and require injectables for pain relief. Heavy periods can be associated with painful periods, and this more commonly occurs if the uterus is enlarged or if the woman has adenomyosis. That is another condition which we will discuss later, which is often coexistent with endometriosis. The next common symptom is painful intercourse or pain during intercourse, after intercourse. And of course, the next very common presentation is with infertility or difficulty in conceiving. Many of these women who have excruciating pain have their quality of life seriously affected and can be fatigued and often have depression. So it can be very, very debilitating sometimes. The next question is, how is it diagnosed? Suspicion, usually we suspect endometriosis when somebody gives a history of symptoms, as I mentioned earlier. Sometimes we diagnose it on a scan where we see chocolate cysts or little cysts in the ovaries with blood within them. And sometimes on a vaginal examination, we're able to see nodules which are hard and dark blue in color, high up in the vagina, which are filled with blood. And laparoscopy usually diagnoses endometriosis, and it's usually used as a method to diagnose endometriosis, in which we can directly see little spots of blood and pigment which is present in the blood in various parts in the pelvis. So let us just focus on endometriosis and infertility. Now, how does endometriosis cause a delay in conception? Now, in mild disease, we don't even know how it produces a problem conceiving, but it is believed that these endometrial deposits can produce toxins and reduce the person's fertility. In more advanced disease, there could be reduction in the number of eggs because of destruction of the ovarian tissue by these chocolate cysts. There can be poor egg quality. There can be tubal damage. And sometimes the whole anatomy of the pelvis is distorted by extensive adhesions. Sometimes these adhesions can encapsulate the ovary and trap eggs which cannot be released and cannot meet with the sperm. So these are the common reasons why a person is infertile or has a problem conceiving. The next question is, what happens if no treatment is given for endometriosis? The thing is, endometriosis is a progressive disease, and as long as the person menstruates, the collections of blood outside in the ectopic endometrium tend to worsen, and so it is a chronic disease. It progressively gets worse. So treatment is usually advocated. And is there any treatment? The next question is there any treatment which can slow down the progression of endometriosis? There are treatments. There are medical treatments, namely combined oral contraceptive pills, progestogens, which is a type of hormone treatment, And when we give GnRH agonists, which are injections, they usually stop the ovaries from working and stop the patient from having periods. So all these are medical treatments to actually slow the process of endometriosis. But the thing is, if somebody wants to get pregnant, these are not the ideal treatments because they delay pregnancy and do not help a patient get pregnant. So how is treatment planned in endometriosis in women wanting to conceive? So usually the first step is to stage the disease. Stage 1 and 2 would be minimal and mild endometriosis. And in these cases, all that may be needed is a laparoscopic surgery, which involves burning these lesions, either by diathermy or by laser. So we actually get rid of the lesions, and this improves fertility. And often, after laparoscopic treatment, the couple is advised to have IUI cycles within 6 months because that can enhance the fertility rate. If a lady has advanced disease, stage 3 or stage 4 disease, then we may think of either surgery as a method of treatment or IVF. Now that decision is usually made depending on the age of the woman, the number of years they've been trying to conceive, and the ovarian reserve, or the number of eggs remaining in the ovary. If the lady is young and has a good ovarian reserve, then surgery may be advisable. But if the lady is older or has a very low ovarian reserve, then we may advise IVF sooner rather than later to help her conceive with her own eggs. The next question, well, we have a few questions come up on the screen. The next question is, how does chocolate cyst require surgery always? Now, chocolate cysts are not always dealt with surgery. If this chocolate cyst is small and is about 3 centimeters or less, we usually do not advise surgery. Now, surgery for chocolate cysts are advised when the chocolate cyst is large, when it produces pain or plenty of symptoms, when it is rapidly increasing in size, when there's a suspicion that it could be malignant, and sometimes when it is obstructing the way when we do IVF, or it's obstructing egg pickup. We must remember that whenever chocolate cysts are removed, it is customary to remove inadvertently some of the normal ovarian tissue, and with that there will be a loss of eggs. So we have to be very careful while deciding surgery for chocolate cysts. We have another question. It says, will women with endometriosis need IVF? Not all women. There are women with endometriosis who do conceive naturally. But of course, their chance of conception will be reduced compared to women without endometriosis. If they have stage 1 and 2 disease, their chance of conception will be slightly reduced. And if they have stage 3 and 4 disease, then they may need help. Very often we do advise IVF, and that is in patients who have, as I said, a reduced ovarian reserve. So these are the questions which we have, and I think I've answered all. So this is endometriosis in a nutshell. All you need to know about endometriosis. It is worthwhile checking if you're infertile and taking adequate treatment if necessary. Thank you so much.